it really doesn't matter what department you work in. You have a very important job. The reason is that you're part of an organization that is in the business of taking great care of our patients and great care of each other. As part of the Lakeland team, you play a critical role in helping to prevent disease, restore health, and save lives. It's hard to do that job well, and very hard to do that job credibly, without also taking great care of yourself. You've probably heard that the leadership of our country and those we care for are asking us to deliver better outcomes at a lower cost. It's hard to be accountable for those lofty goals unless we are first accountable for our own health and our own health-related behaviors. Participation is, of course, voluntary, but we believe so strongly in working to improve our own health that we're going to help those of you who share that commitment. Here's how.
Hello, I'm Tracy Brown, Director of Human Resources, and I'm excited to be here to share information about the MyHealth program. I have Lori Dudek, Manager of Associate Health and Wellness, with me today. We are going to spend the next 30 minutes providing you with a detailed explanation of the MyHealth program. Lakeland has had a wellness program as a part of our health plan for many years. This includes wellness exams and screenings that are covered at 100%. At this time, we are also adding the MyHealth component. The focus of the MyHealth program is to encourage associates to take action and get engaged in managing your health and wellness. The program also encourages a relationship with your primary care physician if you do not already have one. As you recall, Dr. Hamill shared information when lump sum bonuses were provided last year to advise that premiums were not going to change for this calendar year, 2012. However, they would be changing next year. He also stated that we would have a conversation with you before these changes occurred in order to communicate how each one of us could take action and help stay healthy and control preventable costs. In the March 14th edition of The Pulse, Dr. Hamill focused his message from the President on knowing your numbers. This is a three-part plan to help promote wellness and lower insurance costs for next year. The three parts include getting your wellness exam, knowing your numbers, and saving money. This informational session will focus on providing associates with a brief education on the financial performance of the medical plan over the past 5 years, along with a detailed explanation regarding the requirements for benefit-eligible associates if you would like to participate in this voluntary program. We want to encourage each and every benefit-eligible associate to get engaged in knowing your numbers. I'm going to take a few moments and share an overview of the benefits of this program with you. We want to ensure that all associates understand the importance of a wellness initiative. As Lakeland associates, we also have a responsibility to our communities to be role models for wellness. We are 4,000 associates strong and have such capability of making a positive impact on those around us. We encourage our patients to take better care of themselves and do all that they can do to reduce repeat visits to the hospital. We need to take time to encourage each other to do the same. There are two main benefits of the MyHealth program. The first benefit is better health for the organization, and the second is improved health for our associates. Both of these benefits go hand in hand. The most important aspect of any wellness program is the positive impact it has on the associate. Wellness programs can have many positive effects, including improved health, early detection of chronic diseases, and lower out-of-pocket expenses. I previously mentioned the positive impact on the health of the organization also. There is a direct correlation between the improved health of our associates and the financial health of the organization. Lakeland is self-insured. This means that we pay for any and all medical costs to the plan out of our own account. As participants in the medical plan, we all have the ability to reduce costs to the plan by staying healthy, which should lead to reduced expenses for you and for the medical plan. We are first speaking about the financial health to ensure associates are knowledgeable about the importance of being engaged and committed to supporting the financial health of the organization. The information included in the next 3 slides provides financial data to educate associates on the medical plan costs, highlight how well the plan has been managed to date, and focus on the role of the associate moving forward. The graph on the screen shows the medical and dental plan costs for the years 2007 through 2011. As you can see from the graph, the organization has absorbed the majority of the increase in costs for the past several years, and associates have not been asked to assume more responsibility, until now. The blue bar on the graph behind me shows the employer cost since 2007. As you can see, the cost has, on average, continued to rise year after year. The red bar represents the associate contribution to the medical costs, which has stayed rather consistent, without any major increases for the past 5 years. One of the main goals is to strive to continue to maintain the low costs that associates pay for their health benefits. In order to do this, we need associates to partner with us. We need each and every associate to get engaged this year by knowing your numbers and either continuing to maintain a healthy lifestyle or make the changes necessary to start to become a healthier individual. The pie chart on the screen behind me shows the plan costs in 2007, which were slightly over $23 million. The light blue section on the pie chart for 2007 shows that the organization paid 91% of the total costs, and associate contributions accounted for 9% of the total costs. The chart on the right shows the medical cost for this past calendar year in 2011. The total plan costs have increased almost $4 million from 2007 to 2011. However, the associate contribution actually decreased from 9% to 7%. The organization has had a healthcare cost committee who has worked together to maintain a strong network of Lakeland physicians to manage our benefit claims, reduce the amount of out-of-network costs, and encourage strong relationships with our physicians. This next table shows the total number of covered lives or members on our plan, along with the breakout of those members with and without chronic diseases. A member is any individual who is covered under the plan, including associates, spouses, retirees, and dependents. This information shows that members with chronic diseases incur higher costs personally and cost the plan more on an annual basis. The bottom line of the plan shows the average cost per member with chronic disease is $7,085, and the average cost for members without a chronic disease is only $2,103 a year. The table also shows that the annual amount paid for both groups is almost equal. However, there are over 4,000 members without chronic diseases, making up the $8.5 million, and a little over 1,200 members, making up that same amount of cost each year. That means there are 2,800 more members in the category without chronic diseases, yet their annual cost is the same. One of the goals is to reduce the onset of chronic disease in our associate population, early detection of chronic diseases if they are already existing, and to manage the chronic conditions associates may already have. Financial health of the organization, specifically our benefits plan, directly relates to the health and well-being of our associates. Lori is now going to walk you through the slides related to associate health and provide information regarding the requirements of this program.
Tracy, what is a chronic disease?
Some examples of chronic diseases include obesity, congestive heart failure, high blood pressure, and high cholesterol. Let's look at this data in another way. Some of us are more visual, and the pie graphs on the screen behind me show the number of members with chronic diseases in blue at 23%, making up 50% of the total cost of the plan. This next table is a visual representation comparing the costs of members without chronic health conditions to the average cost per member. The red bar shows the average cost per member with chronic health conditions, which is approximately $5,000 higher than the cost of members without chronic health conditions.
Hello, my name is Lori Dudek, and I'm the Manager of Associate Health and Wellness. As Tracy stated, we're both very excited to be sharing the details of the voluntary MyHealth program. Tracy has shared the financial slides, and hopefully you have a better understanding of the financial impact to the organization and the participants. Based on that information, we would ask you to consider how the health of each associate impacts the financial health of the benefit plan. Lakeland is self-funded, and that means Lakeland and the plan participants pay all of the costs incurred. Based on the slides Tracy shared, Lakeland pays about 93% and the associates pay about 7%. This means that what everyone does impacts the financials of the plan, therefore impacts your premiums. Next, we would like to discuss the details of the MyHealth program and highlight what steps associates enrolled in the 2011 to 2012 plan may elect to take to be eligible for discounted premiums in 2013. MyHealth is a voluntary program. It's also a multi-year plan. However, today our focus will be steps associates may elect to take in calendar year 2011 through 2012 to be eligible for discounted premiums in calendar year 2013. While we are starting with very basic steps, our goal is for the program to continue to grow, evolve, and become a robust health management program and eventually offer disease management solutions. So let's share how easy this really is. What do you need to do to be eligible for the discounted premiums? It's really as easy as 1, 2, 3. If you are a benefit participant, you may elect to, first, commit to remaining tobacco-free or taking a smoking cessation class by October 31st, 2012. You are able to make this election on the physician verification form. If you saw your physician and had your wellness exam anytime during 2011 through 2012 or any type of exam and discussed wellness. And number 3, know your numbers. Have your biometrics anytime during 2011 through 2012 calendar year and submit the results on the Lakeland Care form by October 31st, 2012. These include blood pressure, blood sugar, LDL, cholesterol, triglycerides, weight, and height. And all that equals save money. If you continue to be a non-tobacco user, have your wellness exam, document and submit your numbers on the Lakeland form by October 31st, you will be eligible for a maximum $30 premium discount in calendar year 2013. The first year will focus on associate participation only. This means that to be eligible for discounted premiums in 2013, the associate would voluntarily submit proof of a non-tobacco use or agree to take a smoking cessation class, a wellness visit, and biometrics on the physician verification form by October 31st, 2012. Spousal participation is not required. In future years, spousal participation will be required, as well as increased actions each year. Our goal is to get associates engaged, to know their numbers and their health risks, and to take actions to minimize risks before they become chronic illnesses.
If you choose not to participate in this program, would I still be eligible for medical benefits?
Great question. You will still be eligible for your benefits. Remember, this program is voluntary, and you may elect to not participate. If you choose to not participate, then you will not be eligible for the $30 discounted premium. Next, let's look at the form that needs to be completed and submitted. Here's the form on the screen behind me. If you elect to participate in the MyHealth program, this is the form you will take to your PCP, nurse practitioner, physician assistant, or certified nurse midwife and have completed. Once completed, this form will be submitted to Lakeland Care by October 31st, and benefit participants will be eligible for the $30 per pay discounted premium in calendar year 2013. The participant completes Section 1 of the form, and Section 2 is completed by your physician. The goal is for you to engage in conversation with your physician regarding your biometrics to determine if there are any recommended lifestyle changes that are encouraged by your physician in order to positively impact any of the numbers. Take the completed form with you when you leave your visit and follow the instructions on the form and mail or fax the completed form to Lakeland Care. As Tracy stated, without addressing the key underlying causes of chronic illnesses, lifestyle factors, it is hard to imagine that optimal health care can be delivered for all at reduced costs and be sustainable.
Lori, where are the forms available at?
All the MyHealth forms are available at the My Benefits website at www.benefitsolver.com. Paper forms will also be available at each location, and the form is also located on the My Benefit website under the MyHealth link. This is a very generalized example of a multi-year plan. We know that premiums are going to increase at least $30 per pay period in calendar year 2013. Associate, Associate Plus 1, and Associate Plus Family will have premium increases of $30 per pay period. What is very important to understand is that there is no standards to be met in calendar year 2013. This means if your blood pressure is 200/100, while that is concerning, it will not impact your eligibility for a discounted premium. This table shows that in calendar year 2011 through 2012, if associates continue to be tobacco-free or take a smoking cessation class, see their physician, have the wellness exam and biometrics, and have the Lakeland Care form submitted and turned into Lakeland Care by October 31st, 2012, then associates will be eligible for the $30 discounted premium in calendar year 2013.
Lori, what are the recommended ranges for the biometrics?
We will utilize evidence-based research that identifies what the recommended ranges are. We will share the recommended ranges with individuals by the end of May. Look for those to be posted on the My Benefits website. Many associates have asked who Lakeland Care is. Melissa Schultz is here to explain who they are.
Lakeland Care is a partnership between area physicians and Lakeland Healthcare. We are owned by both your physician and Lakeland Healthcare. We are a separate corporation affiliated with all of our participating physician practices and Lakeland Healthcare. We are a not-for-profit taxable corporation governed by a board of directors comprised of 11 physicians. Lakeland Care has managed very similar programs such as MyHealth for other employers for the last 15 years. We work with employers such as Andrews, Leco, Whirlpool, Lane Automotive, and many others in Berrien and Cass counties. All of the information obtained from these types of programs is kept completely confidential and is housed in the Lakeland Care suite of offices. Individual information is never shared with any employer. We share aggregate information such as how many people participated, who completed the program requirements, and percentile information designed to help employers offer effective health education and other health programs for their associates. Lakeland Care will send you a confirmation email within 10 days to let you know we have received your form. If you do not receive an email, please call us at 982-2541. This is a sample aggregate report that an employer might receive. It includes the number of participants and what the program requirements were. And this slide shows the blood pressure statistics for the whole group, the total number, as well as how the blood pressures fell within evidence-based guidelines. And now I'll turn the program back to Lori.
So what are our goals for the MyHealth program? Our goals are to encourage associate participation, to engage the whole family and modify health behavior of the associate and family members, to positively impact healthcare costs, to reduce absenteeism, to improve work-related productivity, and finally, over time, our goals are to measure outcome trends and offer programs that reduce health risks for our associates, to measure return on investment also. These links are the My Benefits website, where you go to view your paychecks, get benefit information, or change benefit information. There is a new link in the reference center called My Health with information about the programs and the forms that you will need to submit if you elect to participate in the MyHealth program to be eligible for the $30 discounted premium. We are also working with our benefits broker to create a net learning module to provide additional education to all associates. Please remember that our goal is to ensure 100% of our associates are educated and informed about the importance of the program, their responsibility in managing their health, and that they understand how to participate in this voluntary program. We hope everyone will get engaged and participate and recognize the benefits of a healthier life. Please also think about your responsibility in being a role model to our community when it comes to maintaining your own health and supporting this program. Thank you for the time that you've shared with us.
We'd like to end the program with a video from Kim Felton. She's one of our house supervisors here at Lakeland, and she has a story to share with us about the importance that a wellness program had on her lifestyle. Please take a few minutes to listen to her story and think about the positive impact that this wellness initiative can also have on your own life.
"12 years ago, through Whirlpool, they offered an incentive with our insurance for spouses who would take a health questionnaire. to find out how your health was, the things that you could improve, and to give your health age. So I filled that out, and we sent it away, and about 2 months later it came to me in the mail. At that time I was 35. I had a 9-year-old and a 4-year-old. And I opened that up and I read through it, and it gave me a health age of 28. And I was thrilled with that. What 35-year-old wouldn't love to be told you're really 28? So as I read it through, at the bottom it told me if I did 2 more things, I could be 26 instead of 28. And one of those things was to do a monthly breast exam. So I thought to myself, gosh, I think I'm just going to be 26 right now, today. So I went to my bedroom, did my self-breast exam, and I found a great big old lump in my left breast. I went to the emergency room, which is where I worked at that time, and after my shift I saw the doctor there, and things progressed, and I was diagnosed with stage 2 invasive breast cancer. I underwent surgery, radiation, chemotherapy, and hormonal therapy, and that's been 12 years ago, and I've been cancer-free ever since. So I think it's very powerful that we're getting a comprehensive health care plan here at Lakeland, and one that eventually will include our spouses as well, because if Whirlpools didn't include spouses, I'd be sick now. And I even got a job from it. As I was going through radiation therapy, my physician had told me he'd like to see me afterward, and that he would like me to work for him. At the time I thought that was just, he was being nice to his patient, but after treatment was done, it was true. He did come and see me, and I did take a job with him after that. I'm really happy to say that I was involved in a comprehensive insurance plan.